Yes, this is our Medicare Q&A. So a client asked me this. Could you share some practical tips on how seniors can regularly monitor their Medicare statements for signs of fraudulent activity? Well, firstly, regular monitoring Medicare statements is crucial for detecting and addressing potential fraud. Here are practical tips on how seniors can effectively keep a safe eye on their Medicare statements for any signs of fraudulent activity. Well, first, understand your statements. First, it's important that seniors understand how to read their Medicare Summary Notices or MSNs or Explanation of Benefits, it's EOBs. These documents outline the services billed to Medicare under their name, the date of service, the provider, and what Medicare was billed. Well, say for example, familiarize yourself with the layout and typical content of Medicare Summary Notice, MSN, or Explanation of Benefits, EOB, so you can spot unfamiliar entries more easily. Regular review. Make it a habit to review these statements regularly. Ideally, every time they are received, Medicare MSNs are sent every 3 months. If you receive any services or supplies during that period, of course, that would appear on the statement. For example, set a specific day each month, like the first Monday, to sit down and review any Medicare statements you've received. If you're online savvy, you might check your statements online more frequently. Third, check on services not received. Look for items or services listed that you don't recognize, such as medical equipment, tests, or procedures that you did not have. This can be an indication of fraudulent charges. Well, for example, if your MSN lists a CT scan or a date when you did not visit the hospital or any medical facility, this could be a fraudulent charge. Verify provider information. Ensure the doctors and providers listed are those you have visited. Sometimes fraudulent charges can be made during the physician's stolen identity. Well, for example, if you see a charge from Dr. Smith, a cardiologist, in a city where you've never visited, it might indicate someone else is using your Medicare information. Compare dates. Check the dates of service. Ensure that the dates on the MSN or EOB match the date you receive services. If there are services listed on the date you did not visit a healthcare provider, this could be a sign of fraud. Well, for example, if your Medicare statement shows a medical consultation on February 5th, but you were out of town that week, this discrepancy could raise a red flag. Double-check benefit payments. Look at what Medicare was billed and what it paid. Be alert on any discrepancies in payment amounts for services, especially for those you did not receive. Well, for example, notice a payment for a series of physical therapy sessions that you never attended, such as inconsistencies in payment and amounts and services should prompt further investigation. Keep personal records. It's helpful to keep personal healthcare journals or calendars. Logging your doctor's visits, procedures, tests, and receive medical equipment can make it easier to verify the accuracy of your Medicare statements. Well, for example, maintain a diary where you note each medical appointment, including what the visit was for, which can be cross-referenced with your Medicare statement. Report suspicious activities. If you notice anything suspicious, report it immediately. Contact Medicare's helpline or use the online services to report potential fraud. Of course, just like I mentioned, you can contact your local Medicare office or Social Security. Quick reporting can help prevent further unauthorized use of your information. Well, for example, you notice a suspicious charge, call 1-800-MEDICARE immediately to report it, or use the reporting feature available on the Medicare.gov portal. And then lastly, protect personal information. Always keep your Medicare card and number secure. Only provide your Medicare number when it's necessary for receiving medical services. Well, for example, only carry your Medicare card when you have a medical appointment, or if you're enrolled in a plan, a Medicare Advantage, just carry your card. No need for Medicare. Otherwise, keep it in safe place to avoid theft or loss, okay? Use available resources. Utilize tools provided by Medicare, such as the Medicare.gov portal, to track claims in real time or shortly after services are provided. Well, for example, register for an account at the mymedicare.gov to access your personal Medicare information and claims in real time. These online resources can help you keep a closer watch on your claims and spot discrepancies soon after they occur. Well, by following these tips, seniors can be more proactive in monitoring their Medicare statements and detecting any unusual activities early on, helping protect themselves against potential fraud.
Discover a budget-friendly retirement or investment alternative in the Philippines. Are you concerned about the high cost of housing and limited pension benefits? Explore the affordable retirement option in the Philippines. For only $250 per month, with no down payment, you can own a home and experience a worry-free retirement. Our dedicated property management team will ensure the maintenance and security of your investment. Take the first step towards securing your future with RLC Residences. Call or text Ria Ilagan at 702-504-9899 to learn more about this affordable retirement or investment opportunity in the Philippines.